No event displays the failure of Just Say No more than a rave. Rave was driven by a new kind of electronic dance music, moving at 140 beats per minute.
When you take music that is a new frontier and you add ecstasy to the equation, it was limitless.
Repetitive electronic music sounds wonderful on ecstasy.
Anybody who's done ecstasy knows music is tremendously enhanced. It's a sensory enhancer, and we're all about sensory experiences these days.
There are definitely those moments at raves where everyone's out on the dance floor and everyone's just feeling the music, and it's like it goes, 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 and then it's there and everyone's feeling it and you're all united and you feel it with everyone else, and it's just amazing.
These raves are hotspots for recreational MDMA users, and their experiences on the drug are clearly positive. Though the drug is illegal and very controversial, there is no definitive evidence to suggest that it has negative effects on brain function. In fact, MDMA has shown to help individuals whose various experiences have prevented them from returning to a normal life. Take the experience of this cancer patient, for example.
Diana Watson is a cancer patient, so? That's
yes.
True. And you took it not because you thought it would help your cancer, but I assume to improve your own emotional condition.
That's right. I was diagnosed to have terminal cancer a few months ago, and naturally there's a lot of fear and anger and pain, emotional pain that surrounds something like that. It has allowed me to open up and have communication with my family that I have never been able to have before. And
there was virtually no social problems caused by MDMA when they moved to make it illegal. The problem was that people were using the drug without problem. And not only were people using the drug without problem, but these people were not your stereotypical drug users.
How often do you take it? You'll pardon me.
Sure. I've only taken it once.
This woman's experience with MDMA indicates that using the drug just once can drastically improve one's psychological well-being. Here's another case study where Kathy Tam, a rape victim, underwent MDMA therapy.
I mean, I had a lot of support from my husband and friends and in therapy, but I needed something more.
A friend referred Kathy Tam to a psychotherapist who was giving MDMA to patients suffering from post-traumatic stress disorder.
By taking the MDMA, it's like my mind allowed me to grapple with and remember the pieces that I couldn't or wouldn't allow myself to remember.
Over a period of time, she was able to get back in touch with the kids and be with them and be a loving mother again. I'm certain that wouldn't have happened without the MDMA.
Without that, I can't tell you where I'd be. I'd probably still be back there, hiding out in my house.
Gail Westerfield, also a rape victim, experienced the same extraordinary benefits as a result of MDMA therapy.
Did it work?
Oh, I'd say absolutely. I had recurrent dreams since I was a little kid. It's like I'd be walking through a house and the lights would turn out, and then this force would overwhelm me. After the MDMA, I fought it once and it never happened again.
4 years since the last MDMA session, the nightmares are gone.
These two case studies show that just one use of ecstasy can improve mental well-being for an entire lifetime. This is an extraordinary quality of MDMA that separates it from other hard drugs and the devastating after effects that are commonly associated with them.
But the bottom line for many users is that ecstasy is not heroin, and it is not cocaine or crack cocaine. And many people simply believe that ecstasy, MDMA, is powerfully beneficial.
I've never heard anybody say to me, methamphetamine improved my life. I'm a better person for having used methamphetamine. Same thing with cocaine. I know people who like to use cocaine. Never heard anybody try to claim cocaine is good for me. MDMA, lots of people think that the drug improved their life and continue to think that after they've stopped using it. That's what's astonishing.
Mithofer's pilot study involved 21 patients. Those getting MDMA with therapy saw more improvement in their mental well-being than patients who got a placebo. Just as important, there were no major side effects.
I don't think there's any doubt that Some people have been scared away from MDMA use by what they've been told. They saw that picture of holes in the brain and they said, okay, not my brain. So I think that the, if you will, the propaganda effort has had its impact.
When I read some of the stuff that's printed by the government these days about ecstasy, I just laugh. I just break up laughing.
I've taken MDMA 100 times. Over the last 20 years, I feel fine. Somehow in our culture, we've developed this belief in science so much so that we ignore the evidence in front of our own eyes.
Clearly, ecstasy use is not limited to the rave culture. It has already been demonstrated both in case studies and in genuine experiments that MDMA holds an enormous potential in psychotherapy.
Now, I'm not saying go out and take the drug, but I'm also not saying that it's bad.